Hello. Once again, it's a privilege and honor to be with you. And today we're going to talk about a topic that is near and dear to me, autism spectrum disorders. It was my privilege for 10 years to be the physician for the early intervention program. And it was there I evaluated children from birth to 3 for developmental delays. And during that time, I saw children who had a variety of different problems in presentation. They were referred by their pediatricians because they often had low muscle tone, they weren't engaging, and there was just something different that had the parents concerned. And the parents would ask the difficult question, does my child have autism? So it is today we're going to ask, what is autism? Autism is a neurologic disorder that affects the way the information is processed in the brain. It is often described as an invisible disability. The kids look normal, they look fine, but they have issues socially and emotionally. It is a developmental disability. It means they develop at a slower pace, at a different rate, with social and emotional concerns. And the thing to keep in mind is, it is a continued lifelong process. And the other important thing to keep in mind is the earlier it's diagnosed, the better the outcomes. For some reason, girls or women are underdiagnosed, but typically the ratio is 4 boys to 1 girl. The true ratio probably is very likely 1 to 2, but often the girls are diagnosed later. These children are often described as being different, even as infants, not quite engaging, not playing as well or cooperating with parents as much as children their age. These children often present making very poor eye contact. These kids, I notice, will fixate. They'll look at a light and they will just look at it and just look at it for a long period of time and not move. They have a failure to engage in typical babbling with their parents. Sometimes they will just look away and not make eye contact. In other cases, which is very concerning and difficult for parents, these children develop normally up until the ages of 2 and 3, and then all of a sudden, they stop developing. They withdraw, and instead they go into their own world. They become detached and socially indifferent and difficult to engage. These children, as I mentioned, often present with low muscle tone. As babies, they often have difficulty sucking and difficulty with fine motor skills. The diagnosis was changed from autism to autism spectrum disorder with the DSM-5, our diagnostic Bible, several years ago. So what is autism spectrum disorder? Have you ever met a kid or remember a kid in school that was just kind of strange, just didn't quite fit in, they were a little quirky? This initially was described as having children who were having Asperger's syndrome. But if you keep in mind, the word spectrum is from very mild, Asperger's, to very severe, nonverbal, non-engaging. It's important to keep in mind that some people have mild delays and some are so severe they require support throughout their entire lives. It's important to keep in mind that autism affects 1 in 59, according to the CDC. That's pretty common. And 1/2 of these children are described as having intellectual disability or borderline intellectual disability or even severe disability, which used to be called mental retardation. 44% have average to above intellectual function. Boys are 4 times more likely to be diagnosed with autism than girls. About 40% of children with autism do not speak at all. And in the course of my practice, I've been able to see these kids grow into their 20s. And some speak, 25 to 30% will have language and lose it. And often those that speak as they go into childhood and young adulthood would only have a few words and use them sporadically, sometimes appropriately and sometimes not. And for some reason, the rate of autism has gradually increased over the last 20 years. And people have asked the question, why is that? Is it in the water? What has happened? It's the fastest growing developmental delay. But what we have found is that increased awareness leads to increased diagnosis. It's important to keep in mind when the child comes in and there's a suspected diagnosis of autism, we have to rule out other medical conditions, and here are some. Fragile X, I've seen that in my practice. Asthma, allergies, epilepsy are often co-occurring. Also, bowel disease, GI disorders, viral infections, and yes, other psychiatric components. Anxiety disorders, ADHD, very common. Bipolar disorders, many of these kids have explosive mood swings that are difficult to control. feeding disorders. Many of these children, very young, have a difficult time eating. And we have to actually refer them to eating disorder clinics. And they also have immune difficulties. Tourette's disorder is common, where the kids have tics. Obsessive compulsive disorder, extremely frequent. These kids will obsessively ruminate on things and ask the same question about the same thing over and over, and it causes the parents a lot of distress. These kids have what we call sensory integration. Sometimes they have fixations with things. Sometimes they cannot tolerate certain fabrics. They cannot tolerate tags on their clothes, and it causes the kids great distress when they're exposed to these. What are the symptoms of autism? The big one that we often see is delay in language development. These kids will repeat over and over the same phrases. You'll ask them the question, "How are you today?" They'll say, "How are you today?" You'll say, "I am fine, thank you." They'll say, "I am fine, thank you." But they have a difficult time initiating reciprocal conversation. They're repetitive, they're ruminatory, and they have a difficulty making eye contact. They often will look away versus looking at you, and they often prefer to be alone. As I mentioned, they have sensory problems. They have unusual reactions to smells, tastes, sounds, like the washing machine or vacuum cleaners. They have difficulty interpreting facial expressions. You can make a face and be upset, and often they cannot read your expression. And the hard part that I've seen for many of these children is they have problems expressing emotions. And often, because of this, they're misunderstood, and people often avoid being around them. And it causes a lot of these children a lot of pain. They very much want to have friends, but cannot make them or keep them. As I mentioned, they will fixate on certain objects, and they have difficulty with pretend play. They will take a toy and not play with it in the appropriate way, like a car, and roll it. They'll just bang, 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 or throw something around, or take a piece of paper and play with that versus a toy. Sometimes, unfortunately, they'll have self-injurious behaviors. When they become upset, they'll bang their heads or bite themselves. And a very, very frequent problem is sleep. Many of them do not sleep, which causes their parents a lot of difficulty. And a very big concern is difficulty with adapting to change. They have to know a certain routine and what's going to happen at a certain time. And if it changes, they are extremely reactive. And these beautiful young people have difficulty in social situations. They often are very anxious. And with that anxiety, I've often seen an escalation of inappropriate acting out behaviors like temper tantrums. So the question is, and what's the question my parents often ask, what causes autism? They'll come and say, what happened? Why my child? A very important variable to keep in mind is genetics. It's involved in most of the cases. Another thought that is a concern is children born to older parents have a higher risk for autism spectrum disorders. And what I've seen in my practice, if one child has autism spectrum disorder, they often will have a 2 to 18% chance of having a sibling often affected, which makes it extremely difficult for parents if they have several kids with autism spectrum disorder. And also that I've noticed, 10% of children with autism spectrum disorder often have also Down syndrome, Fragile X, and other genetic abnormalities. So how do you make the diagnosis? It's a two-stage process. It often begins with a well-child checkup in the pediatrician's office. And many of my parents have told me they took the baby in and they said, something's wrong, something's wrong. And the doctor said, oh, they're just developing on their own pace. But the parents, some of them intuitively know and keep asking the question. And eventually they are referred to a specialist, often developmental pediatricians, neurologists, psychologists, psychiatrists, all play as team members in making this diagnosis. Children can be diagnosed by age of 2 if their symptoms are very obvious and severe, but often is diagnosed later. And there are some very concerning myths regarding autism, and it caused a lot of my parents a lot of pain when I worked with the early intervention program. A big question, vaccines, this is a myth, cause autism. A lot of my parents were reluctant, if they had one child with autism, to not give their other children vaccines. Hear me clearly, vaccines do not cause autism. Despite what you may have heard on the media reports on television, research study after research study has shown and confirmed that autism does not cause vaccines. It causes more harm than good to not vaccine your child. Yet, new cases are on the rise of autism and diagnosis, as I stated, but it is not because of vaccines. More cases being diagnosed are probably due to increased awareness and earlier diagnostic programs. So what is the treatment for autism? My parents come in, what can we do? There is no cure for autism, but I cannot underscore and stress the importance of early intervention. There are developmental windows in children's brains, and if we can catch that window and expose them to occupational therapy, physical therapy, behavioral interventions, it will make a difference in how they live the rest of their lives. And yes, medications can be helpful. These precious children often have severe anxiety that causes them to not function, to hit themselves, to isolate themselves, to throw severe tantrums. Even though many of them cannot speak, they want the same thing: friends, caring, loving, and they cannot express it, and they end up depressed, socially withdrawn. And a very common concern, as I mentioned, is obsessive compulsive disorder, obsessive ruminatory behaviors, rocking, banging. It makes it difficult for them to go out in public and to simply live. ADHD is very common, hyperactive, on the move. These kids will get up and just walk down the hallway in the middle of a classroom day, and it causes severe disruption in the classroom and for their families and in their lives. As I stated, severe behavior problems are a huge concern and a very popular and important therapy, and we have a therapy site located here in Charleston, is the ABA therapy, Applied Behavioral Analysis. And this helps to teach these children how to respond to positive cues. Parents learn how to encourage positive behaviors and to discourage negative ones through this training program. I cannot tell you how important family counseling is for their parents and for their siblings. These children are very much loved, but they are high maintenance and it takes a lot of time. And because it takes so much time, some of the other children are often put on the back burner, and this can be concerning for the whole family unit. And so it is today, my take-home message, and this is a very important message. Number one, you have to speak to their gifts. But whatever it isn't that is missing, there are a lot more things that are present. I always say, speak to the is's. Help the child and others focus on their gifts, their own unique gifts, versus their deficits. Remember, it's a full spectrum disorder, from very mild to very severe. And it is our role as parents, as healthcare providers, as family and friends to help your child, to help the child that you're working with maximize their gifts and skill sets to help them feel better about themselves. And remember, as early as one can, as I stated, I've seen children from babies, and now they're in their mid to late 20s, and it's been my privilege to watch them grow, and I found the earlier the intervention, the better the outcome. So don't be afraid to ask for help. Don't be afraid to ask the question and seek help. And remember, it's a lifelong process. And in severe cases, it means having a child that never grows up. And that is very difficult. And in those cases, we have to encourage the parent. And if you have a child with autism or on the spectrum, you'll have to ask yourself the question, the difficult question, what will happen to my child when I am no longer here? That is a very heavy worry and burden with many of the parents I see in my practice. And I encourage them to seek out other parents who have traveled down that path and found positive solutions. Help is there. I'm encouraging you to look out and reach out to resources. The Family Resource Center is available. There's the Huntington Autism Training Center. And on this website, there will be a list of other resources available for young people with autism spectrum disorder. Again, I thank you for your time, the privilege of being present with you today. And I want to encourage you that no matter what the concern is, and if you have a young person or someone you love that you suspect has autism spectrum disorder or has this disorder, that is a definite sign of strength and not weakness to seek help. And I encourage you to do so. May you find peace on your joy toward hope and healing. Thank you.